Rogate, KTN News, Nairobi.
Right, I want us to have that conversation now on the ongoing clinical officers strike that has entered day 2. And from the story into the studio now, I have George Kibora. He's the Secretary General of Kenya Union of Clinical Officers. Thank you so much for making time for us.
Thank you very much for having me.
Right, of course, a critical time for you to be here today. Let's start off with that particular story was talking about the role of clinical officers. Just sum it up quickly in just a few words, what the role actually is of a clinical officer.
Yeah, I think we start from what people knows, and you know, when you get to those health facilities and you see everyone, you think you call them daktari. That's the common word that is used. Even if there's a cleaner putting on a white dust coat, they are called daktari. But we want to say clinical officers, as I have, you have seen it, is one of the oldest clinical practitioners in this country since 1928. We provide services for all levels of the government sector. That is level 2 up to level 6. We do exist there. We have 2 categories of our basic training, that is the degree and the diploma, and all of them are within our facility. Now, from there, we have specialized. The higher we have in the diploma, previously before we had the degree, we started training people at the higher diploma, which we have subspecialty close to over 18 subspecialty. Those are anesthesiology service who are offering anesthesiology services, oncology, ENT, pediatrics, reproductive health, dermatology, among others. So all those people are in different categories, and we normally say that in the sector we normally give what we normally categorize services as primary care services, and then there are those at the secondary and tertiary level. So those facilities normally focus from preventive, promotive services to curative. And clinical officers normally offer all those services. And that's to mean when a patient comes to the hospital, they're already experiencing they are already having a complaint. So the first person to see those people are clinical officers. And then now you guide that this is a patient who may require maybe another intervention. If it's a patient who may need a consultant, then you refer that patient to a consultant. But you'll find that over close to around 79% of patients who comes to our public facility are actually seen in the outpatient and they go home. So then you get those who probably are serious with some complication, then you admit. And then when you admit, we have those who are addressing these people, or rather seeing this patient in the admission, inpatient, as an inpatient or in the ward. So still clinical officers are there. And as I've said, that in the outpatient where now we see patients go home, clinical officers are in all facilities, starting from level 6 to the lowest level. And we see in those outpatient services, which are clinical services, we offer 99% of the services. So that is to mean the curative services, diagnostic, ordering of tests and the interpretation of those tests, and also doing some procedures as pertained to our own training. Like if it is a cataract surgery, we have those who do those cataract surgery. They are cataract surgeons, and they do close to 98% of the services, and those are quite there. So, indeed, as I heard the reporter saying, you will never put a difference in between what a medical officer will be able to do and what a clinical officer is able to do, because they do more of the same thing. They address the same patient, and if the patient had malaria, whichever medical officer will do is not different from what I do. If it is about addressing an uncommunicable condition like hypertension, if it is what I can be able to do, they will not do it differently. We normally have a departure, especially for those who have now specialists, especially if you have specialists in surgery, then you do the surgical work. And if there are those who have specialists in pediatrics, they do the pediatrics work. So that's why you normally have to separate, and now that is done by the specialist. So indeed, we exist in all the level of the facility, and that is why when we call about this strike, it is that we are going to affect close to over 7,300 facility in the public sector.
Right, of course, very crucial what you've talked about. That's very crucial what you handle.
Yes.
Before we get into the demands, what is like the statistics in terms of numbers? Let's say doctors to clinical officers, the ratio. Is the clinical officers number a bit higher than the doctors?
Very true. Currently, we have around 7,000 who have been employed by the government, but we have some of them who have been employed in informal way. Either they have been hired to beef up the gaps in the facility by some of the counties, which are not appearing in the data. Then you might, if you put them together, you could be around 7,800 if they are put together. But for those on the payroll, who probably exist by virtue of the contract, like the UHC staff, they are on contract, yes, but they have a payroll. They are on the payroll. So those put together, we have exact number is 6,948 clinical officers. And if you look at it, and then we want to say, and why you'll see one of our demand is that the government need to employ more clinical officer. The staff, we have a document called the staff establishment, which talk about the number of staff you ought to have versus the population density. And that is what we normally say there is a bigger gap, because we ought to be having close to over 70,000 clinical officers in the country, because one clinical office is supposed to be equivalent, you are supposed to equate 1 to 800 population density. So that then gives us a very big gap. Even if the government was to employ every clinical officer in this country, the total qualified clinical officers in this country are 32,000. So we have now 7,000 who have been employed. So the gaps is close over to, I mean, those who have not been employed or engaged are over 25,000. So that is a dire shortage. If you look at the real situation, where the government biggest agenda in the Ministry of Health is to increase coverage, then there is no reason that employment should be the agenda of the union, but should be the government agenda.
Definitely.
Yeah.
Let's get into the demands.
Yes.
And according to some of the demands that you have, including the first one, is that the national government, on behalf of the county governments, complies with the court order to finalize and register the CBA in court within the next 7 days.
Very key. Because why we say 7 days is that we have been negotiating a CBA since 2017. Unfortunately, a CBA has a life cycle of 4 years. So indeed, CBA is doing it under only negotiation, we are doing a second cycle of a CBA because we have never had a CBA. The Kenya Union of Clinical Officers was registered in the same year, 2017. And then we initiated a process to have a CBA, which normally now secure the status and the status of employment for, and the terms of employment for their members. So that process has been ongoing, keeping on the table for a few times, then they flop or rather drop out of the table. And then after that, we had a strike in 2019. We had a strike in 2017, trying to push the government to actually finalize on this CBA. Now, in 2019, when we went on strike, they went to court, and we went to court also. The court ordered that we go under what we call conciliation under the Ministry of Labour. So the decision there was that the government was never cooperated, specifically the Council of Governors, which coordinated the counties. So when you look at the counties that they are not able to coordinate, then the conciliator did a report informing the court that the government was not cooperative. That was the report that they did. But again, that matter is still live in court, so to say. In the same matter, when it's still engaging in court, the court normally insists that the parties must continue to talk. So last year, they gave a court order directing the parties to engage and discuss so that we can be able to register concept and report to court. The Council of Governors has never come on the has never actually heeded to this court order or even tried to implement it. And we have been on talk with the national government only through the Minister of health, but with the little progress, so to say, because the main issues that normally cement the gain of the employees has not been factored yet.
But you've seen one of the stories, the first story that we carried, the governors themselves, you've seen how they're talking in terms of, the services not being offered by clinical officers. Well, this situation should be handled. There's a national issue already being handled. Why is the clinical officers dealing with this now?
The governors are politicians, and I think the problem we have in this country is the politician of this country, where today they talk, because when they are in a public rally, they'll tell you that we want to better services, but they can't connect the dot on what you need to do to ensure that the system that ought to ensure service delivery is working. The human resource aspect in the health sector is a key component, because it is the one that will mobilize resources in those sectors. It's the one that will ensure that when you are sick, you can be able to be seen and to be treated and to be done any intervention, including any procedure that you require. So when you take the aspect of the human resource out of the context, or rather out of what you call the health sector, then you fail. But again, what if I have all the stuff that I need without supporting them? Then that becomes a problem. Then you get to understand that we really need to keep the focus in terms of priority and even budgetary allocation to the sector. And that is why you'll see that we have several documents and policies that are never implemented. Look around the document called the Abuja Declaration, where the government committed to allocate 15% of its national budget. We are still doing less than 6% as a country. That was 2011 to date. So how many years are those? It is the government that is on strike. It is the government that has totally decided to abdicate its responsibility. How do you separate a function called maybe primary health care and the one that is offered at the national level, which we call maybe referral services? Right. Is the medication at the referral services different, or is it not different? And I dare say, the governors, when it is working, they say that health is devolved. When it's not working, they say that this is a problem of the national government. The problem is this disintegrated management of the health sector, where the center is never holding. Then the council, then you see now that is why they are jungling in between. Let me give a good example of one of our complaints is that we are asking this government to employ the people who were employed during COVID. They are called UHC staff and the COVID emergency response staff. Right. We are asking them to put them on PNP, permanent and pensionable, because they served their first term of 3 years, and then the Public Service Commission advised the ministry and the Council of Governors to put them on PNP. But the Council of Governors went under a summit that happened last year around February. They said that they want to put them on a continued 3-year term again, right, or contract, which is a punitive term. They are paying them around 50, between 40 and 50, where their counterpart who are on PNP are earning actually a way close to three times of what they are earning. This is what we are saying. We have a government that never want to implement the policies that they have. They continue violating, including the constitutional provision, discriminating their own citizens. So this is what we are asking them to do. And when you look at it, the ministry has agreed, and they say they already have a budget to do that. But on the other part, the Council of Governors is saying extend the contract. What kind of a controversy can we have?
Let me just ask, because away from the national government perspective, there's an issue with the Council of Governors. Have you tried to seek a table with the Council of Governors and have a conversation?
Yes.
And what has happened out of that?
The Council of Governors is one of the non-responsive institutions that we have in this country. And probably I can attribute this by virtue of the current chair of the Council of Governors, who never give priority in terms of the health. Let me tell you about Kirinyaga. Kirinyaga is one of the county that has never promoted staff since people went to devolution. Kirinyaga is one of the county that has never employed health staff on permanent and pensionable since the governor Waiguru took responsibility of that county.
Do you have facts?
Kirinyaga is one of the county that you see we have highlighted, fired 46 clinical officers since 2019. It was overturned, that decision was overturned by the Public Service Commission, which is a constitutional body where all matters that of grievances or touching on employees, if you are aggrieved at the county level, you can appeal that decision at the Public Service Commission. And once the decision of the Public Service Commission is either in our favor, then the county has failed to implement. And yet, when they are sitting, they sit as a quasi-judicial process, which is supposed to be adopted as a court order. So that they continue appealing and putting several cases in court. The reason is that she never wants to see these people back to work. She continued asking, and I can assure you, she has written several letters to the president, asking the president to second staff. The president, when he went there to open the facility that she has built there, which is just a hall without staff, she asked the president to actually second staff from the Ministry of Health. Some of the staff that were seconded there have decided to leave job because they cannot work under Kirinyaga.
But you see,
so the pathetic situation under the county government, especially the Council of Governors, is due to the bad leadership that we have.
But you see, even with the demands, you've only quoted Kirinyaga County here. And with what you're saying, because there are claims that you're stating here, do you have facts?
Yes,
with regards to this?
Yes, we do. Which factor are you asking for?
You've talked about specific things about how people have not been promoted. She's gone to the president and that she's not doing their parts. What do you have this fact somewhere?
We have the fact. We have staff who have left job by virtue of being seconded to the county government of Kirinyaga from the Ministry of Health. And this is because when the president went to launch that facility, she asked for more staff. Right. Today, when you see on the paper, I think last week, part 1, she had advertised for position, and all the advert she advertised was on contract. And I can assure you, no consultant, no specialist will be able to apply for those
Now that that hasn't happened with her specifically, and she's the Council of Governors, as you claim, what other thing have you done to make sure that at least the people working in Kirinyaga, their voices are heard? I
think that's what I'm trying to say, that we have court orders that direct them to be on the table to negotiate. They are not actually obeying the court orders. We have them disobeying a decision of the Public Service Commission, which is a constitutional body. It's not our decision. So if you have an institution blatantly disobeying a directive or orders of the court, so what else do you want us to do? Go on strike? That's what we can do.
Right. There's another thing here. Part of the demands that you have, the second demand actually, is talking about enhanced risk allowance of 15,000 person to return to work agreement that was signed in 2021. Tell us more about that.
2021, again, we had a strike that we were pushing the government to actually ensure that we can be able to finalize our CBA that was started in 2017. Mwatahi Kago was the governor, was the CS then, and we had Oparanya as the chair of the Council of Governors. And during that time, we went under conciliation also under the Ministry of Labor. We negotiated. We were demanding consideration for payment of clinical officer as risk allowance because they act as the gatekeeper in the health facility, because they are now they are one of them highly exposed workers, because exposure means about knowledge, having knowledge about the condition you have so that I take precaution. So when we meet the patient as the first one, you do not know what kind of condition you're dealing with. So we are most exposed. And you'll see the trend, including during COVID, that most of the good number of clinical officers were among the highest infected clinical number of staff. And then we justified that the highest currently paid in the sector in terms of the risk allowance is 20,000. We are being paid a major 3,000. And we said then, if indeed this is what inform, because we are only talking about the risk that is involved by virtue of the work that we do, then we are the most riskier. We are the most exposed people. So we said, this is what we want. We wanted 30,000. We negotiated. The ministry said we can we can work with it 12,
right,
so that the total become 15. We're already getting 3. So what is being added by the government is 12,000. And we were doing like the mathematics, and we want to put the figure so that the government, any Kenyan can understand the kind of the gist, why the government cannot make a decision, especially on services that is affecting the poor Kenyan, because we know that the people who are seated in our office never seek services in our public sector. They either fly outside the country or go to to Nairobi Hospital or one of the highest facilities in this country, like Aga Khan. The figures are, like the Minister of Health only need 29, the Minister of Health only need 29 million to implement that agreement. Together with the counties, they only need around 1 billion. If now you put the counties separately, you'll be surprised that some of the counties need less than 30 million to implement that agreement yearly. So, and in a total, that is that we are projecting an annual budget of around $1 billion to ensure that this stalemate is unlocked.
Around $1 billion shillings, of course.
Just only $1 billion to unlock the stalemate that is now costing lives.
But you know, with the current economic situation, some people would argue, do you think it's timely?
Fadia, what do you know about current economic situation?
I mean, it's a question I'm asking to you, because I want to come back and ask about the doctors are also striking.
Yes.
If you're also striking as clinical officers, what happens to the patients?
Yeah, you know, when the food is on the table, everybody will take to their own, benefit, or rather what they can be able to take. We are only saying in the health sector, we have close to over 23 cadres, professional, and we deal with one patient. Now, unfortunately, where I come from, we normally say that if you don't speak of your problem, you die of your problem. And indeed, it is true. That's why you see men die early than ladies, because we never complain. We have not been complaining. We are one of the badly remunerated cadre in the sector. We are only saying, even one of those, the issue that we are talking about this is about harmonization of the payment in the sector, which is one of the key responsibility of the SRC. But you see, we have a constitutional body that only sit to come and talk to media without doing anything. And that is why we are saying, do we have a responsibility as Kenyan to ask the government to do as pertained in terms of the law and also the constitution? We have a responsibility. If we don't say it, then we become a complacency of the government. When you look at the Kenya Kwanza manifesto, one of the issues that they talked about is the HR issue on how to ensure that they can stabilize the sector. When they tried to do it under now what they call the Kenya Health Human Resource Council, the Council of Governors always want to say that that health is decentralized, but devolved. But every time there is a problem, you have heard the governor from Mombasa what he's saying. And I have heard also the governor Stephen Sang saying that for them, this is a problem of the national government. Why is it that when there is a problem, it is the national government, and when they feel that it is working, it is for them?
Right. Okay, we'll continue with this conversation then after the break, because I think we have not touched on what you're currently doing. Yes. But let's take a short commercial break here on News Center. We are discussing the clinical officers strike that is on day 2 today. We'll be back with that conversation. Stay with us.